Doctor, I'm having trouble passing urine, burning and stinging when passing urine. I've had blood tests and I've had urine samples to my doctor, but the tests keep coming back with no infections. Okay. So whenever you're having burning when you're urinating, instead of going to the doctor and being like, "Doctor, I got some burning," and they're like, "Okay, let's take a urine sample," a really good doctor is going to ask you, "Where is it burning? Is it burning at the tip as it's coming out? Is it burning inside as it's traveling out of your penis? Is it burning at the base of your penis? Or is the pain shooting somewhere else?" Because pain when you're urinating can be coming from a number of places. Is the pain starting like when you push on your abdomen, that lower pelvic area? Is that tender? All of that plays into the story as to why it's burning. This is why you can sometimes see a doctor over the computer through telehealth, and they might ask you way more questions than if you go in person because they don't have the ability to run a test really quickly. But what they have the ability to use is what we call clinical diagnosis, listening to the patient, trying to understand what's happening, and then coming up with a differential, or like maybe it's this, or maybe it's this, based off of what your answers are. So when you're having burning with urination, one, we need to know, is it coming from the tip? Because there might be, you could even be having a little bit of a herpes outbreak right at the tip, and as the urine is coming out, it's burning. Have you had vigorous sex recently? Has someone really, been sucking vigorously in the area? So could it be burning because it's raw down there, right? Is it burning on the inside, and are you noticing a change in the pattern of the urine stream? If so, you might have a stricture or something inside the urethra or inside the penile tissue that could be causing the issue. Is it burning at the base of the penis where the prostate is located? This might be prostatitis. You might have an enlarged prostate. You might have an inflamed prostate. Or is it shooting to the groin area? So all of that is really important. And then, the abdominal pain part is important. And then you also want to take note of the stream. Is your stream reduced? Are you going more often than you normally do? Because particularly if you have a prostate issue, where the prostate is sitting at the base of your the penile tissue, but what it also is a passageway for the urine to pass through. So there's something that passes through the prostate called the urethra. So it's the urine starts in the bladder, it passes through the prostate, through the urethra, an area that we call the prostatic urethra, and then the urine continues to travel and then it goes out. So anytime you're having pain when you urinate, you have to say, is this bladder related? Is this prostate related? Is this urethra related? Or is this the skin on the exterior part of my penis? That's what's related to it. So another piece about prostate issues. We spend so much time talking about the prostate that we forget that one of the main reasons that you have prostate related symptoms is because of your bladder, right? Because the bladder holds the pee. And so when you go to urinate, if the bladder doesn't release as much of it as it should, because it can't get all of it out, because the urethra is clamped down like a clamped down straw, then guess what? The urine starts to back up in the bladder. As the urine starts to back up in the bladder, now the bladder actually becomes weak, or something we call atonic. And that urine sitting in the bladder is actually one of the reasons why you're racing to the bathroom all of the time, why a lot of urine isn't coming out all the time. So once the urine sits there, I want you to think of it like this. If you've ever been out in the wilderness or out somewhere and you kind of peed on yourself a little bit, right? Like a little bit of urine hit your leg and it's sitting on your body. And you do your best job of wiping it off and trying to clean up or whatever, but some of it is still on there. Maybe it's in your boxers or your shorts or whatever. You notice that urine kind of starts to burn. Urine actually is irritating to the skin. So urine that sits in the bladder over time and isn't constantly being shot out actually starts to irritate the lining of the bladder. And so you have irritated bladder that the bladder then becomes weak because the prostate has gotten enlarged, clamped down on the urethra, has the pee in the urine sitting in the bladder longer than it should. The bladder is irritated, and now all hell breaks loose. You run into the bathroom very frequently. You're feeling like, gosh, when I go, not all of it is coming out. You know, instead of that rush stream, it just kind of courses out gently, or just kind of dribbles out, or it takes you a moment to get the stream started. So burning when you urinate could be related to your prostate, but it actually could be related to the urethra, it could be related to the bladder, and it could be related to the skin, right? And so I wanted to kind of tell you that, because one thing that doctors don't spend enough time talking about or don't tell you about is that one of the main reasons you have prostate symptoms is not necessarily because the prostate is enlarged, because we know for a fact that the larger the prostate is, the less likely you are to develop an aggressive cancer. But that the larger the prostate is and the more urine that gets stuck in the bladder, the symptoms start to develop as a result of that urine sitting in the bladder and irritating the bladder. So when we're taking supplements, we want to try to address not just the prostate, but also bladder health as well. And my Prostate Plus Flow supplement does just that. It actually, we've designed it so that it targets the lining of the bladder and it targets the prostate, so that potentially you can see a healthier prostate in a shorter amount of time than it does taking some of the other supplements that are available. So listen, if you are suffering from prostate related issues, all you have to do is ask your doctor, hey doc, I know you got me on this medication, or I know you want me to take this. Are you okay with me trying a supplement? And see what your doctor says. You know, some doctors will get on board with it. Some will scare you and say that stuff doesn't work. And some will actually tell you to go out and get some. So you kind of want to have a doctor that meets you on the middle on it. You don't want one who's like, oh, no, blah, 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 blah. They're like, sure, go ahead and try it. Let's see how that goes. Come back and see me in 90 days. And if you're not feeling any better, let's see what's next. Because it's supposed to be a collaborative process between the two of you. Okay? Good.